The goal is to have each of our present stakeholder advisory board members trying to lead, facilitate a discussion. The facilitator will share information about the key themes that we captured, and then inviting you to also share back other key themes, and then moving on to asking each of you to think through some recommendations that you might have, and then looking at what would be, from your perspective, some actionable strategies and best practices, lessons learned that could really contribute to this collective call to action. So at the end of it, it would be great if your group could sort of have this, these are the top 5 things that we would like to share as our collective call to action. We would like to invite each group to identify someone who wouldn't mind sort of doing the share back. So we want to have also, after this discussion, sharing back to the larger group here as well. Really trying to invite as many voices as possible from all of us here.
We came up with a few ideas for how to be more inclusive moving forward in terms of research. Okay, so the first and probably most important take home is include people from the affected groups from the start, from the foundation of the research design or the foundation of the instrument that you're developing. And in order for this to be effective, you're going to have to be very intentional about different types of ability. I mean, people with sensory disabilities, people with intellectual developmental disabilities, people with mental health conditions, people with obviously the physical disabilities, you know, et cetera, et cetera. You got to be very, very intentional from the very foundation. Okay, so Dr. Mohan was suggesting that we have a lot of tried and true surveys that need to be adapted for people of varying abilities. So we need a center for adaptive surveys. Okay. Here mentioned that we have a lot of folks who are being excluded from medical research because they are in the no man's land that we call not yet diagnosed. And I'm very sensitive to that because a lot of folks who are later diagnosed as having multiple sclerosis live in that no man's land, you know, that lost. And so we're losing data. We're losing data. So the way to potentially deal with that is to rate functions over time. And of course, I would say we need universal health care in order to do that. But anyway, that's getting political. So focus on symptoms, not diagnosis. Symptoms and functions. Oh yes. Overcoming distrust of the medical and research community. And Dr. Mohan mentioned that we may have to start recruiting from non-medical centers, non-medical venues. The problem is that people who distrust the medical profession don't ever show up to their doctor, therefore don't ever get recruited, therefore they become invisible to the research community. So we need to reach out beyond medical centers and medical settings to recruit folks with access to functional needs. So we need to demedicalize recruitment. Okay, now actions matter. Actions matter. It's one thing to talk, it's another thing to do. And if we're not holding ourselves accountable to actually do any of these things, we're failing. Thank you.
So for the first one we have is to understand the intersection between disability, ethnicity, race, and sex, right? We're very fortunate in that some of the people in this room or people who presented yesterday are making big strides to get some big data, right? More needs to be done, and that's said for all areas, but that's a no-brainer for our crew here. The second one is to identify effective strategies for embedding people with disabilities within with the research, not in the research, right? Not as subjects. And that goes along with what the first group said, and that goes with trust, right? But engaging people with disabilities in all steps of the research process, right? Engaged partnership. So the next one is to ensure adequate disability representation within study samples, and that's not just disability studies, that's all studies. And the next one, this one we thought was really interesting, was to create guidelines or effective strategies for addressing ableism at the intra and the interpersonal levels of the socio-ecological model. What we noticed is that there's a lot of policy, organization stuff going on in this in the talks we saw in the past couple days. But when it came to strategies on how people could actually address some of these things in their own personal life, we're not quite there yet in terms of set standardized strategies that are effective. Now for the last one, and this one goes for all research, but definitely for this area too, is to incorporate sustainable action plans to interventions to promote long-term impact for, of course, meaningful outcomes for the people. And that's all we got.
So the key issues that we ended up discussing were to frame accommodations as to what would be helpful versus what is needed. So sometimes in the healthcare world, if you go in saying, well, what do you need? Patients will not share, what will be helpful or what other resources they may need. They'll think that they're only there to share what they need. And so let me give an example because I feel like I've just chewed that up. So if, community engagement, community involvement, maybe that's something they want, but they're afraid to ask for it because they feel that they're in that particular doctor's office or whatever for to ask for only what they need, which may be, an accommodation at work or something of that nature. So just reframing the whole concept of accommodations. And then we talked about another issue, and this is again in all three areas, the art of listening, because that is actually a skill that is a lost skill now. And so it's important to have some training in all programs related to active listening and understanding that what's the difference. And then someone in our group talked about not giving up on research. Don't wait for the perfect. And somebody said this yesterday. One of the speakers mentioned this, having a growth mindset. And so a lot of times researchers are afraid to do research on people with disabilities because there's such a large variation. And so they said it's often difficult to recruit. And so somebody else, I think, mentioned that a few minutes ago, but so we mentioned, not giving up and not waiting on the perfect time, just go with what you have. Okay. And so that was one of the things. And some things we can do, tangible things we can do right now, which you may think is different, but what training do people need to have? I know we have a room full of medical professionals in here, but we think it's important for everybody to be CPR trained and first aid trained. Because like in a higher ed institution, we can have people with disabilities everywhere. And so it's just important for everybody to have that training. Not even just for people with disabilities. But anyway, and then have some type of an integrative mental health first aid training too, as well.